Well, you always have mixed feelings because, this is what I do. This is what I've done for the last 30 plus years. And every day you get up and you go to work at the hospital and you're charged with the responsibility of doing good things for patient care and good things for the community every day. And it's multifaceted, it's complex on many levels. It involves a lot of negotiations and back and forth and speaking and arguing and debating. But mixed feelings, but I feel good about it. I think this is the right time and the right opportunity. I have my health. I feel good. I think we've accomplished an awful lot over the last number of years, and I think the timing is good timing. Sure, I'll miss it. There's no question I'll miss it, but overall, I feel very positive about the new opportunities, and the future is bright. The future where our hospital finds itself today, I think we're evolving and changing. The integration is strong, and I think that when I leave, I'll be very proud to be able to say, good job.
Biggest accomplishment in 31 years?
Yeah, well, I sort of told the story about being recruited for building the new hospital. I mean, obviously a huge number of people involved in that. You can't take individual credit for it, but that's the vision. That was the vision from the outset when I first came to North Bay Civic. That was always the vision, and we spent thousands and thousands of hours. We could probably fill half of this room with the reports that was done. We saw the up and down, the twists in the road. So at the end of the day, to be able to say that that legacy is there, again, with not taking personal credit, but a lot of team, a lot of people. But if I could have played a small part in delivering that, look at the outcome. I mean, the feedback we get is just extremely positive. Sure, we have issues, but all hospitals have issues. All healthcare systems have issues. So probably that ranks right up there. But Cindy actually asked me earlier, what about what's the best, the journey or the destination? Well, you can't get to the destination without the journey, and the journey is what makes you excited, makes you get up in the morning and say, okay, I've got these 20 things I got to do today, so let's get at it and do the best we can to be successful.
You say there are 5 objectives left that you want to do. What
you
are
want
those
me to
5?
rhyme them
yeah,
off?
I do.
Oh, yeah, that's a test. Well, I don't know if I can rhyme off all 5, but basically we all know the requirement of our province through our LINs is that we have a balanced budget framework. We're working diligently on that. We have until September of this year to deliver that. There's a lot of uncertainty on that front. We don't know what the funding is going to be this year. How many times have I told you that over the years? I mean, how many scrums have I said, I don't know what the funding is, I don't know what the revenue is, and guess what, it's the same. But we're working diligently on that, and I'm optimistic we're going to get to a balanced framework as required. The second one is quality improvement plans. We have to publish those annually. And we just finished that for the coming year. So that's where you take your high priorities and you look at what the needs are of the patients and their measurable outcomes. You also tie executive compensation to it. So a portion of executive pay is dependent on being able to deliver on that. Third one is reorganization related to our integration between the two organizations. So we've almost done the reorganization. So all the rollout of that, the structural changes, the policy changes, the framework, the pay scales, and all the business stuff. You see, they're testing my memory now. The fourth one is related to community engagement. So at the end of the day, in this changing world, how do we best engage with the community effectively so that they understand what our challenges are, and as we go through the change of balancing budgets and where have we come from in integration, what does that look like and feel like? So we're planning activities with Pat's help and others to look at advisory structures and committees that we can engage with the public and actually have forums and dialogue. And the last one is partnerships, and everything we've tried to do is around partnerships with the LIN, partnerships with other hospitals in the hub. So we're talking about academic teaching networks and research. So will they all be completely done? Probably not quite completely done, but there'll be my last report, and will be, here's where we are, here's where we've come from, here's what's left to do in my opinion, and here's what I think the challenges are.
What are you going to do? I mean, I know you said you got a serious job, you got an important job, you've obviously been able to spend quality time with your family through that job, but But you're going to be leaving this place, and what are you going to do with your life? Are you
Well-
staying in the community? or
Well,
are you-
basically, we have no plans at this moment in time to relocate. Our kids are out west. We call it stupid Alberta, simply because it's too far away. Maybe Albertans won't be happy with that, but I don't really care. The opportunities to stay involved at some level, I don't like to use the term consultant, because consulting, unfortunately, has a bad name these days. Everybody wants to say that, people waste money on consultants, but I've made a lot of contacts over the years, and I've talked to a few people about could I stay involved, maybe with a particular emphasis on integration and amalgamation, and how to get people prepared to come together, and how to provide shared services. The world isn't going to change. We're going to be in integration and shared services for as long as I can see forward. Obviously, my golf game is pretty bad, so this will hopefully allow me to get a little bit better at that, at least get as good as my wife is. So, that would be important. And she's laughing behind me. I knew I'd get her to laugh when I said that. And travel and family. You mentioned about quality time with family. There are times when, as you're going through a lot of this, you do have the odd regret about missing a milestone or being busy and so on. So now at a different stage in your life, you can step up and say, well, let's do some other things. And you know what? Probably the first little period of time, well, we're going on a pretty neat trip with friends a few weeks after I'm finished, and take a deep breath and look to the future and see what other doors might open.
Any political aspirations?
No. I've been doing politics for 30 plus years. This is the level of politics that I've committed to, and I get asked that question a lot, and I don't really know why, but I do. And no, I don't have any political aspirations at all. It's just not something that, at this stage in my life, I think I've been working hard to maneuver the political landscape for the last 30 plus years, and that's all I need of politics.
Is there anyone, like we asked about successes, and there have been plenty, we're in this, but any disappointments that you wanted to have happen for this place, but didn't happen just because of, just because governments weren't willing, or there just wasn't the political climate locally, or anything that stands out for you?
Well, the glass is half full for me. I don't like to talk about disappointments. I like to talk about positive outcomes and opportunities and changes that have come before us, and so I don't want to focus on any real disappointment. Sure, there are days when you want to take the policy framework, you want to say, you're kidding, that's really your policy? That policy's like 20 years old, or you've changed policy again, or you've changed the people we need to talk to. But I'm not blaming anybody. That's just the way the system works. People come and go, and the use of public funds is critically important. We need to be really accountable. We should be very open always to being measured by our accountability using public funds. We're in the public arena, so it's not like running a private corporation where you can do, I don't want to say more or less what you want, but more or less what you want. We're in the public sector, you're accountable in a much different way to the public, and people talk to me all the time about things. I'm glad they do. And I've always engaged, and I'll continue to engage. So no real disappointments. I could say that the new hospital project, could have been done quicker, but there's nothing to be gained by saying that at this moment in time. We worked through the process as best we could, and we took the turns in the road and the twists in the road, and we learned from those, and we continued the dialogue. And then when politics does have a bearing on healthcare, I know that sounds really odd that I would say that, but politics has a heavy bearing on healthcare. And sometimes you do have to follow the alignment of the political winds. Sometimes you got to bide your time a little bit, be a little more patient. So, but no, I don't have any, I don't have anything that jumps off the page. There's aspects of the job that, if you were to say what don't you really like about things, sometimes you want to say, okay, we've had this discussion for the last 10 or 15 years. Can we get past this? Can we figure out how to move forward? Can we figure out a solution? I like solutions. I don't like problems. I like finding solutions, finding compromise. So sometimes the processes bog you down a little bit, but that's the job. That's what I signed up for. I chose this career. I didn't back into this. I went to school to become a hospital CEO. I knew that's what I wanted to do. Believe it or not, I thought I was going to be a doctor as a kid. So I went to the dark side of administration, as some people would call it. So no, I don't have any outstanding disappointments, and I just think it's really nice to be able to say, when you count up all the accomplishments and you look at over all the years, there's lists and lists and lists of them, and maybe over time, maybe there'll be the odd retirement celebration or something. Perhaps we'll have more anecdotes about some of those things, more specifics. But today's the day to look to the future and ensure the organization is well positioned for the future.
Good. What's your favorite memory?
My favorite memory. Oh, yikes. There's probably not one that stands out. I think probably the relationships. I mean, I think I'm known to be an individual focused on relationships and trust and good open dialogue, and even in difficult times, having respectful, compassionate dialogue with people. So I guess my biggest memory will be the lifelong friendships and the people I've met and got to know, who are all focused on the same thing. How do we get from here to there? How do we provide the best possible outcomes that we can? How do we get past the barriers? People talk about barriers all the time. People talk about barriers all the time. Barriers can be moved. Look at barriers as an opportunity. So probably the friendships and the relationships and the partnerships and the team and the overall team, not just the team I work with, but everybody, right down to every individual doing the job. I mean, I walk through this organization and it's nice to know that most people call me by my first name, which to me seems like a small thing, but to me it's a big thing.
Mark, how has the industry changed, since you started? I'm thinking about things like ALC. And
Yeah.
That's something that probably wasn't an issue when
Yeah.
you
It wasn't an issue earlier on. I mean, we know the system has evolved from the days of significant money being available, and at the end of the year, funds seem to come, and you managed with being less concerned about the fiscal realities of the day. Now the fiscal realities are front and center all the time. Everything is accountability. Everything is accountability. Signing off for every dollar, every $10, every $10,000, making sure that you're accountable. I don't disagree with that, as I've already said. Accountability for public funds is huge. So it's evolved. I would say fundamentally it's still a similar looking system. At the end of the day, what services are you going to provide? What are the needs of the community? Do we have sufficient resources to do it well? What if we don't? What are the opportunities? But it's probably it's more challenging, I think, now than it was when I first came. It's more complex. Now to sit around the boardroom table, it's not as straightforward. I would say I was never in a boardroom that rubber stamps things. I've had the pleasure of not being in that type of boardroom, but it's probably become more complex and much more levels of accountability. But now relationships are even more important. Engagement of staff and physicians and volunteers in the community is more important than it's ever been, because it's hard to understand the healthcare system and it's hard to navigate it. So we need to do the best we can to help people do